Now, you guys have heard me talk about Keven pretty extensively. He's a leader in the senior care industry for over 25 years. Can you tell us in that time what has changed between short-term and long-term care?
Sure. So, once again, I'm Keven Ahmadi. I'm the Area Director of Operations for Volunteers of America. We're an organization that's been around for a little over 123 years. We provide services to a little over 20,000 units of housing across the country in 46 states and the District of Columbia and Puerto Rico as well. And we operate not only CCRCs, but independent livings, assisted livings, and skilled nursing. I'm up here today to represent our newest program called the Preserve. And the Preserve actually is in partnership with Hope Healthcare Services as well, because if you've ever been to the Sun Harvest Orange Post Office, has anyone ever been there where they have orange juice? And I'm seeing a couple nods here, okay. Yeah, the corner of Metro and 6 Mile Cypress. Well, if you haven't been there, it's the best orange ice cream you've ever had in your life, let me tell you. With that, Hope Healthcare Services owns some land there, and we purchased some of that, and we're developing the Preserve, which is an assisted living on the first floor and a skilled nursing on the second and third floor. And it's part of our commitment and our collaboration with the Lee Health System to continue to provide services at the skilled nursing level. Why? Because there's only 17 skilled nursing homes right now in the Lee County area, and they're all running 99.9% occupied today. Yesterday at Gulf Coast Hospital, they were in diversion. Diversion means that any ambulance that wants to go to Gulf Coast Hospital was diverted. Diverted to Cape Coral, diverted to Health Park, or diverted to Lee. Why? Because they're full. There's 45 people in the emergency room on gurneys waiting to be admitted into the hospital. These are facts. That's why you read articles like the one, I think it was in today's paper or yesterday's paper, where they say, please go to convenient care. Don't show up in the emergency room. You will wait there too, but we are heavily populated. We have a demographic that has really aged. So in our independent livings, in our assisted livings, there's a paradigm shifting. The people that used to live in our independent living are yesterday's assisted living residents. Our assisted livings today were yesterday's skilled nursing residents. And we're seeing a demographic. Why? Because, or demographic change. Why? Because people are aging at home much more successful with home health services, home care services, medications. We're eating better. We're living healthier lifestyles. We live in communities that are naturally, retirement communities where we're active. So people are aging in their homes much longer than they ever have. So skilled nursing's today, and we do in our 105 bed skilled nursing at Gulf Coast Village in Cape Coral, we do 850 admissions and that many discharges in a year. It is a rolling machine of in and out, people that are coming in from the hospital to the care center, getting rehabilitation, and back to home. And so if you think that you're going to get on a waiting list to be in one of these places, no. The model has changed. It is about how fast we can get people out of the hospital, how quick we can get them into skilled nursing, and how fast can we get them back out. Because that's what the Centers of Medicare Services is monitoring right now. And we don't get paid for that service if we keep you in those beds. Now, are those beds also certified by Medicaid? Yes, but not all of them. We don't have to certify every bed so that we can accept a Medicaid patient. There are certified beds for short-term rehab, and there's called duly certified beds where we could do short-term rehab as well as accept Medicaid. And that number is shrinking very fast. Why? Because the reimbursement isn't there. And in order to operate and to maintain levels of staffing that are required, that you expect, that the state expects, we have to pay people more money. And so there's a paradigm shifting. And yesterday's nursing homes are now tomorrow's hospital. And they're moving very fast. The more critical care people that we're caring for in our nursing homes, the higher reimbursement we're going to receive starting in October. It used to be about the knees and the hips. No longer do we want to see knees and hips, because the knees and the hips don't pay. If you've had a recent knee and a hip, guess what? You most likely went home, didn't you? Yeah. So guess what? They're forcing it, and they're moving the paradigm, and it's shifting. So I say this for a couple reasons. Why? I agree. You should be all proud of yourself for coming out and getting educated today. But know this, identify who you're partnering with out there. Identify who's got the resources to care for you. Because one of the questions that's going to be asked, and I'm just going to go ahead and answer it now if you don't mind, is what's keeping me up at night?
That was definitely my next question.
And what's keeping me up at night is I can build any one of these properties anywhere in the USA because the demographics are in our favor. There's going to be the haves and there's going to be the have-nots. And the have-nots are outweighing the haves right now, big time. So the issue is not building it. The issue is not filling it. The issue is, can we staff it? And can we cultivate a culture of people that want to work in this environment? And that's the key here. Because right now in Lee County, you got to make $50,000 or more if you want to have a house. Well, we're not paying nursing assistants $50,000 a year. We're not paying housekeepers and laundry people $50,000 a year. So if you're involved in your city, if you're involved in your city, county in any way, shape, or form, and somebody shows up at one of those council meetings and says, not in my backyard, you better start rethinking what you're thinking. Because if you don't have some sort of affordable housing in your backyard, nobody's going to care for you. They're going to go where they can afford to live, and the people are going to be cared for in that particular area. So think about that. It's not when, it's not if, it's when.
And Kevin, is Volunteers of America doing something to move forward with that affordable housing for people to care for our residents?
We're having conversations with Hope. We're having conversations with Lee Health. We're having conversations with the school district. Anyone that owns land. Because it's really easy to build something that's affordable. It's not so easy to build it affordable and pay for the price of dirt that is in existence in our backyard today. It doesn't work. You gotta have free dirt in order to do something that's affordable. Our teachers cannot stay here any longer. They are going to scramble out of here sooner than you can imagine. Our nurses and nursing assistants, they're going to go find cheaper housing. So yes, we actually just purchased, we're going through the soil tests right now in Cape Coral, because I have 460 associates that live in that particular area serving that 36-acre campus. And we're going to build our own so that we can actually take care of our own right now. And as soon as we can find partners out there, we will build more. And we are the largest provider of affordable housing in the country right now.
Yay.